Well, we're pretty stable right now. When I say stable, I mean the census is similar to what it's been over the past 2 to 3 weeks, but it's quite high. Our census is 84 today, which really is almost half of our entire med-surg population. Not all of them are critically ill, some are awaiting discharge, and some have actually been de-isolated because they've been here so long. But the impact of COVID has been very high on the hospital. And to have half our population within the hospital, half our inpatient census to be COVID, creates a lot of challenges. I think we still may see additional peaking over the next week or so based on transmission related to social gatherings and then retransmission to other members of the family, especially those with underlying conditions, advanced age, obesity, diabetes. Often the peak hits 3 to 4 weeks after the holiday, at least in terms of hospitalizations. So far, we have been plateauing. We're hoping we continue to plateau, but I wouldn't be surprised to see additional cases accumulate over the next 10 days. Well, the evidence from the United Kingdom is that it's a distinct possibility. There is scientific evidence that this strain of COVID-19 has an increased ability to transmit person to person related to specific mutations in the protein that allows the virus to attach to our cells. This theoretically would increase transmission once it gets established in a population, and again, we would anticipate if it increases the transmission in a population, it would increase hospitalizations, especially in those with comorbid conditions. We've yet to see this at this point. We know that's in our country, particularly in Los Angeles, in Florida, I believe, as well as in New York State. The models would suggest this particular strain will replace the one that is dominant now within a month to a month and a half. Well, I think the main thing for us to realize is that this new strain has to be dealt with in the same way we are dealing with the old strain, and that is with the basic practices, behavioral practices that we've been emphasizing from the very beginning. Hand hygiene, assiduous hand hygiene, masking outside the home, avoiding indoor gatherings, and when you have to be outside or indoors with others, mask and social distance to 6 feet. I think we have to just continue to do those basic practices. We've learned through studies that have been already completed that the vaccine is safe and very effective. In fact, it's more effective than many of the vaccines that are in common use today. It's safe, it's effective, and to get the herd immunity that we've all heard about, we need to get 70 to 80% of the population vaccinated. So for those reasons, I think everybody should take the vaccine.